Welcome to aminacademy.com. In abnormal psychology, let us discuss about gender identity disorder and transsexualism. Some case studies. Transgender people come from every region around the world, from every racial and ethnic background, and from every faith community. Transgender people are your maybe your classmates, your co-worker, your neighbors, and your friends. With approximately 1.4 million transgender adults in the United States and millions more around the world, chances are that you have met a transgender person even if you don't know it. What does it mean to be transgender? Transgender people are people whose gender identity is different from the gender they were thought to be at birth. Trans is often used to shorthand for transgender. When we are born, a doctor usually says that we are male or female based on what our bodies look like. Most people who were labeled male at birth turn to turn out to actually identify as man, and most people who were labeled female at birth grow up to be women. But some people's gender identity, their innate knowledge of who they are, is different from what was initially expected when they were born. Most of these people describe themselves as transgender. A transgender woman lives as a woman today but was thought to be male when she was born. A transgender man lives as a man today but was thought to be female when he was born. Some transgender people identify as neither male or female or as a combination of male and female. There are a variety of terms that people who are not entirely male or entirely female use to describe their gender identity. Everyone, transgender or not, has a gender identity. Most people never think about what their gender identity is because it matches their sex at birth. Being transgender means different things to different people, like a lot of other aspects of who people are, like race or religion. There are no one way to be transgender and no one way for transgender people to look or feel about themselves. The best way to understand what being transgender is like is to talk with transgender people and listen to their stories. How does someone know that they are transgender? People can realize that they are transgender at any age. Some people can trace their awareness back to their earlier memories. They just knew. Others may need more time to realize that they are the transgender. Some people may spend years feeling like they don't fit it without really understanding why, or may try to avoid thinking or talking about their transgender out of fear, shame, or confusion. Trying to repress or change one's gender identity does not work. In fact, it can be very painful and damaging to one's emotional and mental health. As transgender people become more visible in the media and in community life across the country, more transgender people are able to name and understand their own experience and may feel safer and more comfortable sharing it with others. For many transgender people, recognizing who they are and deciding to start gender transition can take a lot of reflections. Transgender people risk social stigma, discrimination, and harassment when they tell other people who they really are. Parents, friends, co-worker, classmates, and neighbors may be accepting, but they also might not be. And many transgender people fear that they will not be accepted by their loved ones and others in their life. Despite those risks, being open about one's gender identity and living a life that feels truly authentic can be a life affirming and even life saving decision. Now we'll discuss more about gender identity disorder and transsexualism. Case studies highlights the complex experience of individuals assigned a gender at birth that doesn't align with their internal identity, often referred to in older literature as gender identity disorder. Now it's called gender dysphoria or transsexualism, and in terms now recognized by DSM-5. One case details a transgender body facing discrimination at school, while another describes a child's early cross-gender behaviors and identification. Other case studies focus on the challenges of differentiating gender dysphoria from psychosis, issues with the access to affirming healthcare, the impact of potential neuroanatomical factors, and the complexities of social transition such as misgendering and lack to access to appropriate facilities. Historical context and terminology. Gender identity disorder, GID. This term was used in earlier diagnostic manuals but has since been replaced by gender dysphoria. Gender identity disorder, GID, is the outdated terms for what is now known as gender dysphoria, a condition characterized by significant distress due to a marked incongruence between a person's experienced gender identity and the sex they were assigned at birth. The name was changed to emphasize distress and to reduce the stigma associated with it, reflecting a shift towards supportive and affirmative care for transgender and gender diverse individuals. What is the transsexualism? While sometimes used interchangeable with gender dysphoria, transsexualism often specifically refers to individuals who wish to transition their physical sex to align with their gender identity. Transsexualism describes a condition where an individual's psychological gender identity fundamentally differs from sex they were assigned at birth, often involves a deep seated desire to permanently align their body with their experienced gender, potentially through medical interventions like hormone therapy and gender affirming surgery. While the precise causes remain unclear, potential contributing factors include complex interactions to brain structure, hormones, and other biological elements, though societal and developmental factors also play a role. Some case study examples: school related challenges. A transgender boy faced discrimination at the school, including staff refusing to use his correct name and pronouns, being denied access to the boys and unisex restroom, and being forced to wear feminine attire at a school event. Childhood gender expression. A case study described a young boy who, from a young age, identified as female, preferring dolls and playing with girls, and dressing in feminine clothing, which caused him later distress and withdrawal. Differential diagnosis. A study presented a case where a patient with a male assigned sex at birth, but a female gender identity was initially diagnosed with schizophrenia. The case highlighted the importance of distinguishing gender dysphoria from psychotic disorders, as some symptoms like delusional beliefs about gender can overlap. Healthcare access and navigation. A case study of a transgender youth named Travis showed the difficulty of accessing affirming healthcare, including long travel times to a transgender friendly clinic and the need for extensive communications with insurance companies to resolve coding and coverage issues. The key themes from case studies: social and systemic barriers. Transgender and gender diverse individuals often face prejudice, discrimination, and lack of understanding from institutions like schools and healthcare systems. Mental health and well being. Gender dysphoria. Gender dysphoria can lead to depression, anxiety, and suicidal ideation, but a supportive environment can positively impact mental health outcomes. Importance of affirming care. Access to affirming healthcare, including mental health support, hormone therapy, and competent medical professionals, is crucial for those experiencing gender dysphoria. Distinguishing from other conditions, clinical case studies underscore the need for accurate diagnosis to differentiate gender dysphoria from other mental health conditions such as schizophrenia and dissociative identity disorder. So far, we discussed little detail about gender identity disorder, transsexualism, some case studies. We have done. Please subscribe our YouTube channel.